Kirti, your that video quality also has come very nice. Huh?
Acha, okay.
No, yeah, you have gone to so many people.
Okay, thank you.
Okay, okay. Uh, so we are live now. You are you getting an echo?
No, we are not getting.
No, sir, we are not getting.
Uh,
But it is showing live on YouTube.
so friends, am I audible, Dr. Iyer? Kirti?
Yes, yes.
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 So we start with our program today. I tried to do it in a very, very simple and very friendly way. We are all going through a very, very bad phase right now. Everybody accepts that. So me and Sagar, we are trying to decide what were our present situation. So came down with these three terms. That is CCC. What do you mean by CCCs? COVID clinical situation, post-COVID clinical situations, and what are the care options. Then the third was a DDD, that is a dilemmas of daily practice, and what are the hands-on experiences. Everybody has got different kind of experiences. What I'm going to do is my next 9 slides are very simple slides of our day-to-day experiences in our OPD. So this you can just take a picture of it and then share with all our people so that they can see it on YouTube also, or they can join on Zoom. Because once more people start joining on Zoom, then it is sometimes difficult for them to get entry into the meeting room. The big question is why COVID patients are returning to hospital after recovery, so-called recovery. We really don't know whether they are completely recovered or not. And this is a very, very big problem. Means the records of the hospital treatment are not properly available. We don't know whether the patient has received steroids, whether the patient has got remdesivir, or whether he has received tocilizumab. You have to ask what is the cost of the injection, what he has received. Because by the time they come from a big hospital or a big center, they are bankrupt also and they want to take treatment in a smaller hospital. If you ask a question to them that do you ever fully recover, there are almost anything between 45 to 80% people say that either they have headache, extreme fatigue, mood changes, insomnia, and QOL, quality of life. 40%, almost 50% people say that they have worsened quality of life. जिंदगी में कुछ मजा नहीं है. And there are a lot many other problems which are there. So this is a very good study as well as statement that several mental illnesses and risks from COVID-19. It is at both ways word. It can cause mental illnesses. It can worsen the mental illness. And this is from the UK study. The type of symptoms what people were having: fatigue, breathlessness, joint pain, chest pain, vision problems, to muscle ache. I have seen a person with intractable muscle cramps. He has gone to all neurologists, all orthopedic surgeons, hoping that they are going to make him all right. And he is still not responding and having a lot of problems. Situation one: a patient comes to you, he is a walking patient, or the patient is doing all your regular duty. He's asking for assessment of post-COVID lung fibrosis and how we are going to manage it. Lakshman, can you help me in such situation? Because you have seen so many patients of COVID and they must be coming for follow-up also.
Yes, sir. We see many patients, sir.
So how do you assess them?
So when they come for follow-up on the OPD, we judge the clinical status, and then if needed, we do the radiological imaging for them. So clinically, we ask them, do they still have fever, whether they have cough, they have breathlessness or not, which is present. And besides that, other general symptoms like they'll have tiredness, mood swings. Some go into slight depression as well, whether there is any neurological manifestations or not. So we look into the multi-system involvement, whether this patient is having or not. And more often than not, some of the patients come with complaints of breathlessness on exertion even after the COVID is recovered. So for those patients, we suggest to do a repeat CT scan and maybe repeat the inflammatory markers as well, whether to see whether still there is any active infection or not. Like the CT scan images which you are showing, many patients post-COVID lung fibrosis is developed in these patients. So in these patients will require Perfinex, they will require bronchodilators and all those things. And they will need a pulmonary rehabilitation for as well.
Okay, Lakshman, I will come to you after about half an hour. I have got few questions in my mind. Then, is there any clinical radiological delay? Means the X-ray is bad, the patient is okay. The second question is, what are the pulmonary rehabilitation exercise which a patient can do after recovery? So this was my first situation, clinical situation. Then there are a lot of psychosocial issues, depression, obsession, cleanliness, and even up to phobia. It is, the world is divided into two type of people: those who are overconfident to those who are overprotected. In the medico families, especially for the head of the family, there is always a fear of contacting the disease. So I come to Kirti because you are seeing lot many patients, and of course diabetes we are going to discuss later on. But if people talk to like this with concern to you, how do you approach them? How do you at least assess them?
Especially you said medico families or
Even not even medico family, non-medico families also.
okay. See now, actually, presently I'm not managing any COVID patients or post-COVID also. I did duty that time, and then now what I'm seeing is really I'm seeing many post-COVID patients with the history of COVID. But they are now coming to me for sugar mainly. Not for the, like Lakshman said, for other conditions like pulmonary conditions. Most of my patients are like uncontrolled diabetes only now post COVID, and everybody gives history of COVID either in June or July or August, at the most September. But what I'm seeing now, mostly already they have maybe we don't know whether completely recovered or not, but they're at least their sugars are not under control. So such type of patients I'm seeing now. Somebody had lost some member in the family. This is also like in one particular OPD I saw, like lady came and she said she lost her husband. Man came, he said he lost his wife. So this is also happening, and that's why there are so many things. Sometimes they are trying to hide also that
Correct, yeah.
they have suffered from COVID. And then next visit, then they are telling कि last time हमने बताया नहीं आपको, but हमको COVID हो चुका था. So something like that is also happening. So fear is still there, like but some people, we are seeing all types of emotions, like for such patients who have either suffered or who have seen maybe death in the family. So it is very, very difficult situation actually.
Thank you. And Dr. Iyer, I am coming to you on this issue, but at the same time, I request other participants, so Savita, Gitanjali, also to open up and talk about their experiences. Dr. Rudra Gowda also. Dr. Iyer, how you correlate the psychological association with your favorite subject of sleep also, because that is our next slide.
See, I was very active till month of March, 21st, 22nd. And somehow I had lot of work in March. I was hopping from hospital to hospital, doing work for sleep and doing polysomnography. And I was wondering why I am getting so much work. And then suddenly after 24th, when the lockdown happened, there was sudden gloom in my mind. And I being now 68 years, I was told strictly by everybody, including my wife, that you don't have to go to clinic. That sudden change in my mind, in fact, I suffered from sleep maintenance insomnia. To be very frank with you, because suddenly there is a gloom and you don't know what to do. You get up in the morning, but you can't go out anywhere. You can't do your patients. And the patients are giving me phone call, but I have to tell them, I'm sorry, I can't see you. So then I tell them what to do. I said them because then in between we had a international webinar uh, on the science of sleep medicine. And from California, Dr. Deepak Srivastava, he was in the intensive care. He is a close friend of mine. He told that we cannot do polysomnography sleep studies anyway after the lockdown is over. Even afterwards also, you are not supposed to do this work because there is a close contact with you, with the patient, and there is technician also can get the COVID. So all these things put together, I had a very difficult time, and I have only started my work only since last month. But now the thing is that we are not, the patients, they are coming, they are mostly having insomnia. And they tell that they are seeing a lot of bad dreams. And they have, some of them have lost their near ones in COVID. Then another issue is that many people, relatives have gone abroad and they are not able to come back. And they are all stuck up there because the flights are not resumed. So this is also a matter of great worry and tension. And then those who are here, their children are abroad, they have a worry, suppose something happens to me, who will come? So this is another issue, people cannot travel. Leave alone traveling abroad, you can't travel inside the country. You can't go in train, wherever you go, there is a fear of COVID. So this is a very severe mental punishment given to everybody on this earth, including doctors. Those who are working in hospitals, you ask them. My own niece is a pathologist in Sion Hospital. She said, I have done some crime in my last birth that I have to go with all these things and do all this work, this COVID duty. And it is, once you come back home, you have to just go directly into the bathroom. You cannot go anywhere else. So all these things are happening, and it's causing a lot of mental harassment to many people. So
Yes,
this is
thank
in
you.
short that people are suffering from insomnia, depression, and also the important point here, give me 1 minute, Dr. SV.
Yes.
Important point is here, those who have very severe COVID and those who have died. But my own friend from Dombivli, he was a urologist and he died because of COVID at the age of 35. He had his hospital just behind my house and he was obese. And there is a report I have circulated in my group also that those who have obstructive sleep apnea, they are very prone for COVID and their outcome is also very bad. And unfortunately, or I don't know, I didn't examine him, but looking to his habitus, he must have had, and poor fellow succumbed to COVID. So this is a very unfortunate that sleep disorders can aggravate the situation of the COVID. Thank you very much.
Thank you, Dr. Iyer. We are going to come to you after some more points about sleep problem. There is a one general question for everybody. Suppose if somebody is too much obsessed with cleanliness and other things in the family because of some mishap, do you develop something called as obsessive compulsive neurosis? So what is the drug of choice for obsessive compulsive disorders? Anybody who can say it, put in the chat box or can say loudly?
Sir, fluvoxamine would be the drug of choice for OCD.
Any other opinion? Akshay?
What exactly you want to know? I didn't understand.
See, there are a lot of people. There are a lot of people who are developing obsessive disorders. So there is a specific antidepressant which helps for the OCD condition, and without ज़्यादा खींचा-खींची ना करके, chlorimipramine is the drug of choice for such type of things. Chlorimipramine works very nicely, and you can unmute yourself and then talk about your next situation. So now, from these psychosocial issues, Dr. Iyer, I'm again going to invite you later on, but you just have a look at this slide. What is the your role of melatonin? Can you use smart combination of antidepressant and melatonin? One of my pediatrician friend has told me that cyproheptadine helps for both ways, because there is a gross loss of appetite in post-COVID time, and there is loss of sleep also. So cyproheptadine, and unfortunately, there are some people who consume more amount of alcoholic containing tonics and cup syrups. That is the really other side of it. Now, we have got almost now 17 people. What I'm going to do is, Akshay, Farah, everybody has joined. I'm just going to go back, and we're just going to tell them what we have done, and then the points of discussion will come later on. So this post-COVID clinical situations and care, dilemmas of daily practice and hands-on experience. The question is why the people are coming back. Lot many symptoms are there. Mental illnesses are both pros and cons of it. Persistent symptoms of COVID-19 patients. The Lakshman had talked about assessment of post-COVID lung fibrosis management. Akshay, Farah, you can come give your comments later on. Let me go through the presentation fast. Psychosocial issues, depression, obsession to cleanliness, and phobias, all feelings from overconfidence to overprotection, and medico families, especially for the head of the family, and drug of choice for OCD. I told you, chlorimipramine, it works better in all the situations. The sleep, Dr. Ayers told about checking for OSA, high prevalence, high incidence, and high mortality. Now, can we use combination of drugs for inducing sleep? Now, next very, very odd point is extreme weight loss and sarcopenia, loss of muscle mass. How to assess that?
Sir, you unmute yourself.
Now I am audible. Now it is audible, no?
Yes, yes.
Yes, sir, yes, audible.
Okay. So this about sarcopenia and weight loss. What is your Akshay and Farah? What is your take? How you are seeing the patient? Do people really lose that much amount of weight? Akshay, Farah.
Can I comment?
Yes, please, sir. Please go ahead, sir.
I have lost 10 kilos without doing anything, sitting at home. But I don't have any COVID. Many of my friends who have also lost weight, they say, I have not exercised, I have not gone out also. Is that something to do with a regular diet? I don't know. Regular diet at regular time. That is one thing we have to consider. Thank you.
Farah, any comments from others?
So a lot of patients we are seeing with a lot of muscle wasting post-COVID, especially the ones who had a lot of critical illness. So that is one thing. And as Dr. Iyer also mentioned, in OPD also I've seen a couple of patients, at least around, if not 8, 10, who have lost a lot of significant amount of weight loss, who have not suffered from COVID. And on complete evaluation, as for a clinical evaluation for weight loss, you do their X-rays, CTs, PET CTs, and nothing has come positive.
But then, do you assess their adrenal functions, sodium, potassium, chloride?
Sodium, potassium was checked. I did cortisol in 1 or 2 patients, but not in everybody.
Okay. Bharat, very nicely put. My question is, can we estimate their testosterone, and if it is on the lower side, can we give them anabolic steroids?
I have personally no experience of using testosterone on patients, but they're all young patients that I saw who had lost a lot of muscle mass and who had lost a lot of weight. So I really don't know the role of testosterone in them. I did not check the testosterone levels.
Okay. Any other comments from others? Akshay?
Dr. SB,
yes,
there is a issue of sarcopenia with aging process.
Yes.
So I don't know whether because of extreme stress during COVID, many people have aged also. They are looking older for their age.
Yes.
This is also possible. And in the aging process, there is a sarcopenia.
Correct. Accelerated aging is one of the concept which was, and what you have commented last time, your discussion was the sense of entrapment, expatriation, and lot of bereavement about the loss. And means there, my patients used to say that they are suffering from a sense of emptiness in their work schedule. That emptiness and inactivity that really killed people. So that yes, Akshay, bol. Everybody is free.
If you see the literature, there are two entities which is called as, one is brain fog, and second is long haulers. Those who have symptoms, like they will come to the OPD, non-specific symptoms, myalgia and all that. So whatever you do, it will not settle down. So what in last few days I'm just observing that. So when I just searched the literature, I found that there are two new nomenclatures in the post-COVID syndrome. One is brain fogging, and second is long haulers. So you just need to treat them symptomatically. So dizziness. You do everything, ultimately it doesn't come out anything.
Norm haulers.
Long haulers,
Or sometimes we get in the patients who are worried well. Their all investigations are normal, but they are not well. So this worried well and fat file syndrome, these are few people who situations which are very difficult to handle. And what worst thing they do is they come with their big fat files and they dump it on your table and ask them to see each and every paper out of it. That is something funny. But Akshay, please put these two words, brain fog and normal haulers, in our chat box.
Long haulers.
Long haulers.
Yeah.
Not now. What is your experience, Farah? Because you have been appreciated by the controversial governor of Maharashtra. He hardly appreciates everybody. He fights with everybody.
No, I completely agree with Akshay, Dr. Iyer sir, and you also, because we have seen many patients having a lot of weight loss because of COVID. And as you said, it's accelerated aging, and we see it's overall, like we see patients losing a lot of hairs also, bunches of hair. So many patients have developed complete alopecia also. There's loss of hair, there's early aging, loss of weight. But then what I see is after 2 to 3 months, they start putting on weight also. It's not that once they lost, it's difficult to recover. But yes, they do lose a lot of weight. And I've seen patients losing up to 15 to 16 kgs of weight also. Some of my patients have lost that much of weight. And all these psychosocial issues, yes, it's a difficult issue for them. But then it takes time for them to come out. We need proper counseling. They require proper counseling and follow-ups. But then I agree, lot of weight loss is there. Hair fall, weight loss, myalgias, fatigue, everything. And that goes on for about 3 months or so. That's what we have seen so far. Yeah, it takes time to recover. Yeah.
You have to tell that it is a 100 days movie. And see, they develop something, a sense of helplessness. A very odd helplessness sense comes with everybody. Any other participant has got comment? Anybody else you want to speak on this extreme weight loss, sarcopenia, and anorexia? Your own experience. This we are going to go around, and I'm just going to go rapidly to the next thing. I request everybody of you either to get yourself vaccinated. I'm getting my shots tomorrow at the 11 or 10 months only. the first dose of pneumonia should be Prevenar 13 after 1 year, pneumovax 23. Hepatitis, if you are a diabetic or you have some comorbidity, please take 4 doses of 1 ml each at 0, 1, 3 and 6 months irrespective of your previous vaccination. Otherwise, do your anti-HBs titer. If your anti-HBs titer is not correct, you please take this 4. And about COVID vaccine, we are going to keep the subject for the next time. Akshay, what is your opinion of giving pneumonia vaccines at the interval of 8 weeks? Is there any guideline which says that we have to give the vaccine at 8 weeks interval, or we have to wait for 1 year only? Farah, you are practicing adult vaccination, no?
Yes, sir, I do practice. But I have not repeated it in another 8 weeks. And you can give either of it, sir, because either once you've given Pneumovac 23, the next one will be Prevenor 13.
Of course.
Or it can be either way. You can first give Prevenor 13 and then also give Pneumovac 23.
Yes, ideally, it is in guidelines that you have to give Prevenar because it gives a long-lasting immunity.
Effect, immunity.
And then you have to give
Pneumovac 23.
Pneumovax 23.
Yeah. But it can be done the other way also. In case if the patients have already taken Pneumovac 23, still they can go for Prevenar 13 later on.
Correct.
The second dose,
Yes. And we have to be really very careful about comorbidities. Anybody, I can see 2 comments here, but if you've got anything to say, you can put the things in chat box. Now, the next situation which I'm going to give you is Farah has already taken out the air out of my presentation. There are certain things which are serious, but there are certain things which are not so serious also, but people are worried. This hair loss is one thing. And a person used to, just put 1,000 hairs on my consulting table with one comb. And the second is skin infections with or without any skin lesions. And what you can somebody diagnose what is this skin condition? There is something very funny in this skin condition, and the person is a multi-millionaire, multi-crore business owner, builder, and entrepreneur in Navi, Mumbai. They have gone to different people, and the only complaint was itching, and that too nocturnal itching. Any taker? Can anybody diagnose what it is? You can see something like a track. Can you see something like a track here? And there is a small lesion. And I treated that patient.
Sir, it's a parasite. Sir, it's a parasitic infection. I can't remember the name.
No, it is scabies.
Okay.
It is scabies. You can see the burrow clearly. I treated that patient, and you will not believe, I had a hell of a time with all their family members. How the hell my husband can suffer from a disease like scabies? How you are given treatment for scabies? And one thing, if you are clinically very strong about scabies, and if you treat the person correctly and with the correct precautions, the person is the happiest person next day morning because he had lost sleep because of scabies itching. The husband was smiling, and with the disease which was only considered to be of the rag pickers and poor people has now come back also to people who have suffered or who are recovered from scabies, from COVID, and everybody has learned the news of mucormycosis affecting the COVID recovery patients. So we have to be very careful, clinically very vigilant, and even during my telemedicine things also.
Excuse me, Dr. SV.
Yes, sir.
Dr. SV, yes. if you see scabies in a good family, you have to suspect underlying immunocompromise.
Correct, yeah.
We don't know whether he has HIV.
Really? Yes.
Yes,
now, whether doctor
in very good families, if you see HIV, if you see scabies, or you have a extensive reaction to a mosquito bite, these are all signs of immunocompromised host.
Yes. And one more situation about these skin disorders, it's even after the fungal infections, even if the people are completely all right, totally asymptomatic, They have to continue treatment for another 20 days, 30 days, because the fungi are deep-seated and they are going to cause more and more infections and more problems. So there are certain problems which are pertaining to physicians. You will all agree that follow-up percentage is very poor. How to improve by reminders and other things. And still people do a lot of medical window shopping, going for Ayurveda, homeopathy, Siddha, what. Forget patients, come to yourself. Be selfish. What is going to be the situation of a single physician owned hospital? What are the rules and regulations? Is going to be a big, big dilemma. Then, because of COVID, a lot of people did expansions. But I am now suggesting all of you to think about even the reversal of the expansions also. You will see advertisement of all the ventilators on sale for 50,000 rupees, 1 lakh rupees. So you have to think of how you are going to plan your practice, how you are going to have your retirement plans. If you are not done your adequate healthcare medical insurance, which covers include bypass, including all transplants, go for the highest possible. 15, 20 lakhs is not a good cover at all. You should go for more, and you go for a family cover so that it can cover the whole family as an umbrella. This I am telling you from experience of my own very close friend who had to undergo a liver transplant, and he didn't have that much amount of insurance with him. And not the very important thing is, don't believe in anybody. There are 5 P's, which 5 P's we should not forget in your practice. Number 1 is a politician. Number 2 is a pleader. Number 3 is a police. And number 4 is your fellow physician. These P's are, they talk to you very, very sweet on their face, but they can sue you anytime. So medical indemnity should be in crores. You should go for medical indemnity of 2 to 3 crores. For Akshay, Farah, you should, like Fortis and Reliance, you should go for in crores. Otherwise, it can take a really, really bad turn. So friends, I'm just coming to the end of everything. That this is an open forum for all of us, for our experiences and lessons. So there are bricks, there are threats to start a COVID unit in locality. My friend Dr. Bhandari faced the same problem, but you get bouquets and appreciations and encouragements also. There are problems related to billing, under and over billing, appropriate and at what cost. Because I know one hospital which is charging almost 3,600 rupees per day for as a cost of PPEs for the patient. So one thing is definitely that the big time lesson, master teacher was Professor COVID-19 in the rest of our life. Is it going to change our behavior, nature? Are we going to adopt the concept of minimalism or slow life? And for all our friends, almost we are all 20 people here. Sagar also has joined. So I request you suggestions from future similar meetings, how whether you should go for it. There was a plan of going for a case presentations also. So I just go rewind. This is an open forum. Problems pertaining physician, serious to non-serious, adult vaccination, extreme weight loss, sarcopenia, sleep, hypnotics, psychosocial issues, and post-COVID lung management. Now the floor is open for anybody. You can have your opinions. I am going to stop sharing the screen.
In your case, where there is a patient of scabies, there is kept hair on the head. What is that hair?
No, that was two hair different loss. Things. That was hair loss. Hair loss.
Hair loss because of scabies?
No.
COVID.
Two different
because
things.
of
COVID. So Sagar, you must have seen thousands. So what is your observation? Do people who recover out of the ICU, they come and see you and thank you later on, or do you meet them?
Sir, unfortunately, sir, the kind of life we've had, sir, we've not seen that, sir, because at a medical college and, and so like we're still in that acute phase. And sir, the post-COVID survivors, sir, the thing is that, sir, it just passed off to a different unit from the ICU to the HDU, which is still with me, and HDU to the ward. And sir, it's a pity because we've had such remarkable survival stories, but sir, we've had so many that residents also don't remember, the We've had post CPR survivors of COVID who have walked home. We've had patients, but sir, unfortunately, we have not been able to get even that rewarding feeling of sending the patient home ourselves, because we clear the ICU bed, the next patient comes.
Yeah. So it was more of a thankless job.
Yes, sir, absolutely. It was an absolute thankless job. And sir, what you said about the politicians, I know, sir. In the start, how everybody was sweeping on MGM, people from Bombay, the ones in power, the ones not in power, the local MLA, MPs, everyone coming, wanting their photos, wanting me to take them inside, putting them in PPEs. And, moment we wanted something from them, that time I'm talking about March and April when there was no PCR machine in Raigad. So, MGM was the first one to get it. We were asking, can we get some assistance? Not even, sir, for the, buying the kits, at least can you write to someone to, for the permission and this and that. So, sir, it's not I think at the end of the day, it's back to normal now for us. It is quite a bit of thankless job in the sense, sir, as an institutional level. I'm sure, sir, the experience will be different, when you are managing a smaller number of patients and giving good quality of care. But at an institute level, sir, it was just fighting the crisis and it was a numbers game. So that was our essential experience. Besides all the clinical, we have a lot of lovely data. But from an emotional point of view, essentially, it was just a numbers game, doing the best we can for the community. That's it.
Right. But you did not have any publications from your institute. That is actually a big problem.
Sir, we had two, sir. Actually, I had two in both international journals, consensus paper and others. And sir, a lot of the residents now, because we have got time, we are doing the backward analysis. So because during COVID, we had no time to look at even all this. But now everybody started looking at the data. So now we are doing the retrospective analysis. And sir, we've had over 5,000 admissions. And in the ICU HDU, my last number was around 2,000.
Oh God.
Yes, sir. Last 8 months.
One more very intriguing symptom people are having, and that is causing problem of our all OPD chats and everything, that how you can recover their taste and sense of smell. Is it possible to recover?
Sir, something very interesting, because I have been attending a lot of forums in the international thing also in the start. Sir, there were a couple of lovely theories and lovely papers which postulated that we have been thinking of COVID in a very wrong way. Everybody has been assuming that it was a primary respiratory disease, and in hindsight, that the true number of patients who experience respiratory failure, if you see from a population level, were very few. So they postulated that COVID actually is a disease of the nervous system, and it is not a disease of the lungs. Lungs are an incidental bystander and who take the hit. But more patients are experiencing this anosmia and all. And so there were in articles suggesting that it can have a long-term consequences involving the hippocampal, causing long-term dementia and behavioral issues. So there's a lot of data suggesting that the primary mechanism, it definitely has neurological features, which we don't see, and anosmia being the most recently popular one. And so anosmia, even the AIMS guidelines said that some patients have had it for over 6 months.
Quite good. That is one of my patient was telling that while he is eating bread, chapati, bhakri, he feels as if he is eating a newspaper, and the wife is worried. He doesn't know whether he is eating bhakri or eating newspaper. Then the wife was really worried. She said that how to convince this person that all these things are going to come. Then I had to tell him jokingly that now you stop eating bhakri, you start eating chapati, then you will feel like you are eating a postcard. Sometimes you have to get the things on a lighter side of your vein also. Lakshman, can you tell about how you should suspect clinically aspergillosis and mucormycosis?
Yes, sir. So let us go back in 2009, 2010 when the influenza pandemic had happened. That time we had seen many cases of aspergillosis. So that was influenza associated aspergillosis. That was very common. So something similar to that we are seeing now in the COVID pandemic as well. COVID-associated pulmonary aspergillosis, which is called as kappa. So this kappa is quite common, which is there seen especially in patients who are having long-standing COVID, being in ICU for a long time and then deteriorating. We should always suspect this COVID-associated pulmonary aspergillosis. But a more serious condition is COVID-associated mucormycosis. Now, because for COVID patients, we are pumping in steroids. I have seen many patients getting lot of steroids, which rather than 6 milligram of dexa per day, they are getting up to 125 milligram of methylprednisolone 3 times a day. Plus, these patients are usually diabetic as well. So, diabetic patients pump in steroids, and COVID itself maybe being an immunocompromising condition, these three factors play a significant role in causing mucormycosis. So, any patient who comes with some nasal stuffiness, who says that he has difficulty in breathing or loss of smell, make sure that you look at his nose. If you see any blackish colored discharge, or you see any proptosis, a patient having swelling of the face, or a change in the voice, any such symptom which you see, we have to make sure that we investigate whether this patient is having mucormycosis or not, because early pickup of mucormycosis is very important. Early debridement is very important. Otherwise, the mortality rate can be as high as 90 to 95%.
Exactly. Yeah. I completely agree with Lakshman sir. That's why it's important even to give a reference to a ENT to come and examine the patient. If you notice any swelling, blood discoloration, or black discharge to the nose, and especially if they are diabetics, sugars being high, call a ENT and then let them examine so that you pick up the problem early. That's important too.
Another thing I will suggest is go for a HRCT, all sinuses,
Yeah.
all paranasal sinuses. Because
Correct.
normally when you ask for HRCT sinuses, they do a limited study. Then you miss the ethmoidal and the deeper ones. But if you go for the more detailed study of paranasal sinuses, this is one which can pick up mucormycosis very earlier.
Yeah,
So we
my
are
colleagues in Hinduja Hospital have actually had made a case series of mucormycosis. We have also seen at least 2 to 3 cases of mucormycosis associated with COVID. So this is something which we have to keep a watch on.
Yeah, fantastic. Thank you, Bopara. Thank you, Lakshman, for your inputs. Yeah, I'm very happy that today we have crossed our number to 20 and the screen is full. Dr. Vivek Patankar is from Kudal, Dr. Vijay Shinde, my classmate from Mandgaon. There are a lot of Dr. Vijay Kumar is there. Those who want to share their experiences, you are welcome. Can see Dr. Sajdev also, Dr. Meena Biswal, Sanjeev Sane, Asmita. I also want you to communicate with us on WhatsApp that what kind of programs which we should have or which we should conduct in the next future. Because in the beginning only I said that this is a totally non-sponsored program. Means it is not related to any pharma industry, it is not related to any instrument industry, it is not related to any institute. So Sagar had a very wonderful idea of having two combinations, one informative lecture of about 15-20 minutes and a short or a case discussion depending upon whether the case has been worked up completely or not. Sagar, what are your take homes? How we should go for further?
Sir, last meeting, sir, we had discussed, we could have the case-based scenarios as one option. And sir, but it really depends, sir. We can do cases. We were talking about formal programs. So, sir, I think it's open to discussion still, sir, for everyone.
काय सॉरी काय लाईव्ह नाही का नाही नाही लाईव्ह स्टॉप लाईव्ह येते मला इथे
So, sir, we were going to ask everyone, sir, about those case-based scenarios versus modules. So, we were talking about doing a separate academic program for the PGs, like having these fixed recorded sets that we could get all experts. And sir, one was, sir, for our physician association level, where we could have a combination of things, like everybody could bring forward an interesting case of the week, and we could do, sir, maybe 2 cases per session, followed by 1 open session. So, sir, we were going to ask everyone for their inputs today.
Dr. Vivek Patankar or Dr. Arudra Gowda, you are also been listening to this. You can unmute yourself and speak about it. Gitanjali. विवेक पाटणकर आज गाणं नाहीये तुझं पल्लवीज आयफोन ऑल्सो इज म्युटेड Gitanjali, what do you think? Should we have this kind of activity or not? And if it is there, what should be the content of it? Dr. Sajdev also can put forward. Do you feel that the PG students will be benefited with this?
Hello.
Yes, please go ahead. Vijay, bol na. Hello. You can unmute yourself. You please unmute yourself. Vivek.
Sir, I think maybe people are finding difficult to unmute. They must be on the phones then, but I don't know.
Okay.
I think only Farah ma'am and Lakshman and you and me are. I can see that the mics are off intermittently.
Because Amit, I think Amit is Amit Bondwe. Amit, are you audible? Because Amit has been part of one of the vaccine trial also in KEM. Sagar, I make you co-host and you just manage the...
Sir, but they are, so they need to speak.
Yes, so you have been sending the request for whether to mute or not mute, but probably people are willing to stay muted. Hello, sir. Myself, Dr. Amit Bondwe. I was lucky to be part of COVID Task Force KM Hospital. This is a very great initiative. First and foremost, I would thank sir. सरांनी आम्हाला सगळ्यांना ही opportunity दिली. Second of all, probably sir, uncoiling साठी थोडेसे better efforts आपल्याला सगळ्यांना घ्यावे लागतील. आणि sir, quite a few people have. Am I audible?
Yeah, you are audible. Absolutely.
Yes, sir. Quite a few physicians are still in the phase of uncoiling. की आता आपण सगळ्यांनी coil केले आपल्या practices. काही लोकांनी shutdown केला, काही लोकांनी त्यांचे quite a few people have reduced their visiting hours. So now how to uncoil, probably we might need and consensus kind of a thing on that, or maybe our association can guide other sister associations about uncoiling, how are we going to do, and probably more use of teleconsultation, because COVID has taught us about teleconsultations, and even quite a few patients are really wanting, in fact, here on, nahi sir, iske aage main to aapse teleconsultation pe hi milunga. So, pros and cons of that. People have who have seen more patients on teleconsultation, their views on that, their pros and cons, their legal aspects of such consultations. Asal चालू करून
Amit, your bandwidth is very low.
आपण चालू करू शकतो. So it's about more of cases. Hello.
Yes, you are audible.
Hello.
Yes, please go ahead.
Yes, sir. So every session can be divided into two. One is uncoiling sarke, or teleconsultation, and then the second half can definitely be of case related kind of a thing. So that's my overall take on such kind of sessions. And of course, sir, any session, any educational session is always benefit. कोणाला कशा प्रकारे त्याचा benefit होईल, we might not be able to gauge that. To gauge that, of course, people would have to join, and then only we will understand that. आणि मग आपण एक प्री आणि पोस्ट ऍक्टिव्हिटी पण अशा प्रकारे करू शकतो. Just to understand how people are thinking about a small group discussion or small focus group discussion, which also will be helpful for us also to get into that activity and get into more of such activities. Sir, over, sir.
Yes, thank you. Sagar, you want to add? Dr. Rudra Gowda, all other my friends, Vivek Patankar, Sanjeev Sane.
Thank you, sir. Thank you.
Hello, please go ahead. Dr. Iyer, you want to add something about the concept of having a e-clinic?
What clinic you told me?
No, we are thinking of having a clinical case presentation.
Hey, I've been deprived of seeing the patients of COVID because of my age. I would like to see some real experiences by our own people. I would like to enjoy how they have managed all these things. I feel very bad that I'm old. I would have been younger. I would have done good work also. And secondly, to the slowed life, I think we need injection thyroxine to be injected into the lifestyle of many people.
Yes, right. So, friends, it is exactly now 1 hour since we are logged in. If there are no opinions and comments from others, it's time for us to stop the recording and conclude the meeting. I will be very happy if you will give us your feedbacks uh, about what type of activities we should have, and please inform all your good friends who are not only techno savvy but very rich clinically. They have got lot many things to tell, and this is going to be almost a lot of art of giving of knowledge and experience to everybody. Yeah, with the information given by Farah and Lakshman, even if we could pick up in one case of mucormycosis early in our clinical evaluation, that will be really worthwhile of all these kinds of small group discussions. There is no point in talking very high funda and very high quality investigations. But thank you everybody to be part of our seminar. And Sagar, I got one question, that there are people who come with IL-6 and CRP reports very high. Should we manage? Think of anything. Sagar, Akshay has left. Sagar also has left. Okay, then I think Dr. Saddev. No, bol.
Sir, can we try L-carnitine and tocopherol in post-COVID fatigue syndrome, sir?
Yes, there are lot many studies.
Yeah.
There are lot many studies, but see, unfortunately, all these studies, unless they come as a evidence-based guideline, there is no point.
There is nothing guideline in COVID, sir, so far, internationally or nationally.
Yes.
Only admitting the patient and giving high dose of steroids. For 5 days and then discharging high dose of steroids. The patients are being treated mechanically in super specialty hospitals. What I think, even if the person gets admitted in second or third day, they give remdesivir. They start all, and seventh day there is no scientific treatment. What I feel, sir.
Yeah, it is more of a individualistic, and the institution wise the things are going to differ.
No, not that I am commenting.
Yes,
there is no follow up. That is
that is the biggest.
There is
problem.
no follow up. No.
Yeah.
Because they cannot repeatedly go to the star hospitals for follow up. They have to come to the general practitioners only. Correct. Or the physicians.
Yeah.
Thank you, sir. Thank you.
Farah, anything you want to add?
No, that's what we have. That is why we have started with the post-COVID rehabilitation package in Fortis, because after discharge, the patients are quarantined. We cannot expect them to come to the hospital, and it's not actually, it is risky for everyone else also in the hospital. So we always do digital consultation. So we have offered them a package at concessional rate, so it becomes feasible for them economically, and plus they are monitored so that we can pick up the complications if they are going it at an early stage and prevent further problems happening to the patients. So we have given them the package, and many patients have enrolled and they follow up digitally with us for at least a month. And then later on, they come and show us in the OPD. So actually, if you give them at concessional rate, they do come and follow up. Many people are coming to us post-COVID after discharge.
Thank you very much. Thank you everybody for your very active participation. I stop the meeting here. I stop the recording. Yes, please. Go ahead. Dr. Patankar, please. Hello. 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 So thank you very much on behalf of Physicians Association of Navi Mumbai and API Kokon chapter and all my physician colleagues. Thanks for being with us for last 1 hour. We conclude here, and let us see what next Friday 5 p.m. with some different kind of topic. Thank you very much.
Thank you, sir. Thank you.